I think for most patients, not for all of them, it's very important to have people, physicians, the whole area around, they can rely on, that they are honest to them and that they support them in any way that is possible. And there's so many ways. I mean, writing an SMS, I'm just thinking of you, how are you? Could mean a lot for a breast cancer patient that doesn't feel well at that time. So it's not only the big things you can do, it's very often the small things, the little things you can do to support a breast cancer patient. I think first really to get explained what kind of tumor they have, what it means, what the possibilities of treatments are, and not only, I would wish that not only those treatments this hospital or this doctor provides will be told the patient, but also treatments they might get somewhere else which might fit exactly to their tumor, which is quite difficult to achieve. It's also that we tell them if there are trials going on that fit to your tumor, try to get into the trial. You get at least the standard of care, which you would get anyway, but maybe you get something added on, which might be better. Then you can do the treatment before surgery, the neoadjuvant treatment, or you can do it after the surgery. The treatment before surgery is newer, and patients sometimes are afraid that this tumor is still in the breast, but having a treatment, you can follow up if the tumor changes or not. And if it doesn't, then you might change the drugs you give the patient. So it's important to know that there might be a treatment before surgery, and also I think to talk about side effects and how to cope with them. The same if there are trials, try to get into trials, but also really to build the surrounding of people from all different parts that can be helpful for you. And do it, if possible, as long as you are feeling quite well. So, I mean, there are so many social aspects in the metastatic setting, more than in the adjuvant setting. Finding the treatment, talking to the doctor, maybe, can I just stop with the treatment for a few weeks because I'm so fed up with treatments? Is it possible for me or not, or does it change how the drug works if I stop? We have drugs like that. So talking openly to the doctor about the fears, about the expectations of treatment. Where do you want to lead? Do you just want to get rid of the pain? Or there are so many different things. And also sometimes it's a surgery, but before everything you have to do a biopsy, if possible, of the metastases, because sometimes it changes to the primary tumor, so that you really get the right treatment.